Okay, so we'll go ahead. So sense of humor and speaking skills are essential for an eye doctor. And we've heard a lot about in the past few minutes about the communication skills that we need. We shouldn't be emulating the picture that you see over here. Why is it necessary to have a sense of humor and speaking skills? Because many patients have been scared, have been frightened by some other eye surgeon. They've come to me for a second opinion and somebody's already told them things they don't like to hear. Or they've come to you for the first time and are going to be frightened by what you're going to tell them. So the patients need to be put at ease. They will be more receptive to what you're saying if right in the beginning they're at ease. And when you're starting your practice as a youngster, it's your speaking abilities which will set you apart from your competitor in the initial stages of practice. Before your surgical skills become known, you started out in a small town. People don't know you. They don't know that you were brilliant and in a previous fellowship you got the best resident prize or whatever. It doesn't matter to them. They can see you, they can hear you. It's your communication skills which are setting you apart from people who've been there 10 years, 20 years. No, this new doctor talks very well. You have the time to talk. So use that time. You got 30 minutes, 45 minutes you can spend with a patient because you've got only 2 or 3 patients in the morning or in the day that you're practicing. Use that as your strongest weapon against a busy practitioner who's got 200 patients in his OPD. So before your surgical skills become known, it is important that your speaking skills should be known far and wide. Explain with examples that they can understand. So I always say the eye is like a camera and the retina is like the film in the back of the old film cameras. And if the person is above 50 years of age, I tell them, you will understand what I mean. Your son sitting here will not understand film cameras. So it's a joke because they know film cameras. The youngsters only know the digital cameras. So then I tell them that the retina is like the film at the back. And then I tell them that you pretend that if it's a young person, I tell them pretend it's a film camera, which you've not seen, but you've heard of, something like that. You can use models of the eyes or color atlas or patient software on a computer, whatever it is, to explain very graphically what you mean. People don't know where is retina, where is cornea. They interchange. They feel the retina is the front layer, the cornea is the back layer. They don't know. They have not studied medicine. So don't expect them to know this. Explain to them with models. I tell them the cornea is like the front glass in front of my Rolex watch, and I joke with them. I said, not that you have a Rolex watch, but the front glass of my Rolex watch is flat. However, our cornea is not flat. It is dome-shaped. It is curved, like the curve of a cricket ball. So use analogies, examples they are familiar with, and that humor should be subtle. So they smile. There is a smile coming. You don't have to tell them jokes. Let me tell you this joke or that joke. That's wasting everyone's time. Let's take a few practical scenarios. So they will ask me questions. Doctor, is my cataract ready for surgery? Now you are dying to operate the cataract tomorrow. The patient has got 6/9 or 6/12 vision. And he's asking you this loaded question, is my cataract ready for surgery? So I tell them very frankly that it is important whether you are ready for surgery or not. Your cataract I can take care of today, I can take care of tomorrow, I can take care of it after 6 months or even after 1 year. How much of a handicap do you face? If you face an handicap, if you're not happy with your vision, I'll operate you tomorrow. If you're happy, we'll see you again after 3, 6, 9, whatever period you want to do. So you're telling them the truth. At the same time, you're putting the ball in their court and you're using a little bit of humor. And then the second question, doctor, you'll be doing my surgery by laser. No, now what is laser? So I tell them that yes and no. My answer to this is always yes and no. I said I will be doing this surgery by what you think is laser. The actual machine is called phacoemulsification, but it's a very long word. So busy eye surgeons don't describe it because they feel that you will not understand. So they use the word laser. It's not actually a laser. It's a machine which is like my ball pen. And I show them my ball pen. And I say that the tip of the ball pen vibrates at very high frequency, 40,000 times per second. And it churns up the cataract. So phaco in Greek is cataract, is lens. And emulsify is liquefy, like to make carrot juice or orange juice. So I make it little light and I'll be using this very powerful machine. And since I explained the word to you now, there's no need to call it laser. Another question, doctor, which IOL is the best? you will be using the best IOL. Now the problem is when you got 20 different packages. I don't have packages. I have only monofocal and multifocal. There is no package in there. So I will explain to them about monofocals and multifocals and pros and cons. Once they've decided on that, I will tell them you leave the IOL choice to me. So I tell them that this is my cost. I don't have counselors. I have a solo private practice. I tell them this is my cost of surgery. And if they can't afford it mentally, I can drop the cost by 10,000 and put a lens which is little less expensive. But that is all in my mind. I tell them I'll put the best lens possible for your eye. And they say, doctor, you're not giving me a package. The previous person I went to, because they come for second opinion, had shown me 20 different packages. So I tell them, yes, when you go to a restaurant and you have to choose between kali dal and yellow dal, you know which is best. So you can choose. You like kali dal, you'll say, I want kali dal. If you like yellow dal, you'll say, I want yellow dal. But here, if I tell you that this lens is 100 rupees, that is 200 rupees, you won't know which to choose. So let me choose the best for you. Ah, doctor, that's fine. And then you will use only drops anesthesia. If you're using drops anesthesia, you can say truthfully, yes, I am of the old school, so I use a peribulbar block. I don't use topical. So how do I defend myself? So I'm not defensive. I tell them, yes, we can use drops anesthesia, but then my BP and pulse rises. Your BP and pulse may rise. So it's better that we are all comfortable. And I'd rather me being comfortable than you being, so little small injection, and that's it. So I convert my so-called weakness that I don't use drops anesthesia, everyone around me uses it, into a strength by telling that I'm sorry, but we want to be comfortable. No, what's the point? And you guarantee I will not need glasses after surgery? I said, no, I don't guarantee that. We'll try and make you what is called spectacle independent, that for most things you will not need glasses, but to see extremely fine things, for example, to see your spouse, you may not need glasses, but if you want to see the printed work on the border of her sari pallav, you may need glasses. So again, use a little bit of subtle humor to change the situation. In glaucoma, doctor, I find it difficult to remember to put my drops. Is it okay? So I tell them, yeah, it's okay. I mean, occasionally we all forget things. I forget to have my lunch sometimes. But don't make it a habit. If so, then ask a caregiver to help you or have some schedules or whatever. Will I go blind because of glaucoma? So I told them, no, you come to me. My job is to see that we at least preserve this vision. You tell them, of course, glaucoma. Don't scare them. Glaucoma is a one-way street. Glaucoma is a one-way street. You gaya so gaya. That's not the way. You tell them, no, you've come to me at the right time. You got fair amount of vision, irrespective of whether it's tubular or 40 degrees or 60 degrees left. You got a fair amount of fair is difficult to decide. You are also fair, they are also fair. We will preserve this vision to the best of our ability till your dying day. Will surgery cure my glaucoma? So of course you tell them that nothing is permanent in medicine, but hopefully your need for drops will lessen, maybe even go away, things like that. Will it result in cataract? Yes, there is a small chance that it could, but even if it occurs, that's not the end of the world. We can always do a cataract surgery. And can you restore vision in my left eye, which is blind due to glaucoma? And I tell them, can you revive a dead person? No. So let's forget about that left eye. Let's talk only about the right eye. And so you get these questions in every field. So my sugar is under control since 20 years. Doctor, why I have got diabetic retinopathy? But I'm under control, doctor, perfect. I don't eat rice. I don't eat sugar. Then I tell them that in spite of that, see, when you were a child and you wore a hard hat on your head, did your height stop increasing? No. So some things are programmed that the longer the duration of the disease, in spite of perfect control, you will can get diabetic retinopathy. But because your control is perfect, it is not gone to the end stage, and so on. So there are so many questions, and but the important thing is to answer all of them with humor. My replies that I gave you are not the only possible way to answer the question. It's only meant to guide you the manner and style. Don't get irritated or defensive in respect to any question. And smile when the patient comes in, and smile when you say thank you at the end. If possible, escort them to the door of your room. Give them that VIP status. Thank you.